name is Danica, and I'm your nurse for today. Mr. Holmes? Okay. Let me verify your name and date of birth. Today we're going to go ahead and I'm going to suction your tracheostomy, okay? All right. Let me verify your name and date of birth. It's Jonathan Holmes, and your date of birth is 6/9/77. Okay. So, Mr. Holmes, today, whenever I start suctioning your tracheostomy, if there's any distress or discomfort or any pain, I just want you to raise your hand and make a fist for me, okay? And that'll let me know to stop, okay? Okay. Clean my hands. And first I'm going to go ahead and listen to your lung sounds. And normally I would listen underneath his gown. After I listen to all the lung feels, I hear some crackles and rhonchi. So yes, he does need to be suctioned. I'm going to clean off my table, and I have all my supplies here. I'm going to make sure that I have my oxygen here with the ambu bag so that I can oxygenate him prior to suctioning him. And I have my suction canister here on the wall. I'm not going to turn it up any higher than 150 because any higher than that would cause tissue damage. And then also I'm going to check my suction to make sure that it's working. And my suction is working. So I'm going to go ahead and open up my suction care kit. I'm going to go ahead and we're going to put a little waterproof pad there underneath his trach. And I clean my hands again. Normally I would make sure that the bed is at least at elbow level. And being that I'm going to treat him as though he is an unconscious patient, I would lay him lateral and I put like a little pillow underneath him, and I wouldn't have him completely flat but almost flat so that I can get those secretions up. So my bedside table would be clean. It would also be at a nice level for me. I'm going to go ahead and start opening up my equipment. I've already cleaned my hands. I'm going to open it up around the edges, away from me. I did have to put some different gloves in here because the gloves that are in here are not my size. And I'm only opening up around the edges, being careful not to touch inside. I did use the box from the trach kit so that I can have something to pour my, I'm going to use normal saline for our hospital protocol, so I'm going to carefully get that out. Only going to touch the outer part of it. Going to pour normal saline 1/2 inch in here. This will be to help clean out my suction catheter. I'm going to put that there. Then I'm going to go ahead and grab my gloves. I've already made sure I have my ambu bag right here so I can be able to oxygenate my patient. I'll give him 3 breaths before I suction him, and I'll use my non-dominant hand. I also have my suction tubing here. My suction is already on. I've already tested it, so I can go ahead and put on my gloves. And I'm careful to only use the edges. My hands are sterile, so I'm going ahead and getting my suction catheter. And I'm going to act as though this is the catheter that I don't have to lubricate first. I'm going to go ahead using my non-dominant hand, connect my suction. Careful not to get my sterile pen dirty. I'm going to go ahead and oxygenate you now. So I'm going to move your trach over, your mask over, and I'm going to go ahead, connect the oxygen. Just allow the air to go ahead and inflate your lungs. Okay, put that there. My suction back. I'm going to go ahead and put in the suction catheter into his tracheostomy. This portion right here is the tracheostomy. I'm going to go ahead, carefully insert it. Once I start to meet resistance, now I'm going to go ahead and suction. No more than 15 seconds. I'm rotating it as I suction it and pull it out. No longer than 15 seconds. And then I will wait. Gonna give him a chance. Gonna go ahead and put the mask back on. And then if I felt as though he needed to be suctioned again, at this point, I would go ahead and, while my suction is still connected, go ahead and suction, clean out my catheter. Go ahead and oxygenate him again after waiting at least 30 seconds. Take the mask off. 1, 2, 3. Pick up my suction. Once I meet resistance, now that I have my suction, I'm going to rotate it as I pull it out. Do it within at least 15 seconds. Okay, and now that I'm done, put the mask back on. Since I'm done with his suction, I'm not going to suction him anymore. We're only going to do it up to 3 times. And then I would also, once I dispose of everything, I would go ahead and I want to document, listen to his lungs again, make sure his lungs sound better now. There's no rhonchi. And I would go ahead and turn my oxygen off, my ambu bag oxygen off, turn off my suction. I'm going to go ahead and dispose of all my items here by throwing them away. I would put my suction catheter inside my glove here. And all my items I would be throwing away in my trash receptacle here.